We're going. Let's try it again.
3, 2.
John Bartholomew and I are going to get into really the heart of the caregiver policies portion of this series of interviews. And John, one of the things that I've seen in working with caregiver training is that the caregivers are sometimes exhausted.
Yeah.
And when you have a training session, no matter how exciting the information might be, if there is no light at the end of the tunnel, it really does kind of go by the brain and doesn't stick. So
Right.
what's your experience with having the training sessions inspiring the caregivers?
Well, I think that a lot of times you have a self-selected group of people who actually can come to trainings.
Okay.
And they can be maybe the people who have more resources available and are more aware that there's trainings to take, and can get somebody to take care of their loved one while they come to a training. It's one of the reasons it's also offered online, so that people can take it when they do have a little bit of time to spend. But otherwise, a lot of people feel like they can't leave their loved one.
And that's a big challenge because of that feeling like no one can care for that person as well as I can, and I don't want to ask anybody to. So especially in a spouse situation, I'm sure that would be a hurdle.
Yes.
What ideas do you have to break that?
Well, one is to do a little bit better public education campaign about the value of taking a short break.
By short break, what do you mean? We're now into respite, aren't we?
Yeah, we are. In fact, Canadians call respite a short break.
Do they really?
Yes, that's their terminology. They have a short break coalition and everything. And it's something that a lot of people feel like, oh no, that's not for me, I'm okay. But if they only knew the benefits for the person they're caring for as well as themselves, sometimes you need to step away. I was just talking to somebody today who's raising a small child, and no special needs or anything, but she's like, I need a break. I need to go camping this weekend with my friends. And imagine if you're taking care of somebody with significant health needs, maybe cognitive decline. It's a 24/7 job that's not easy, mentally, emotionally, financially stressful. You need to take a short break. And it's not just for your own health. I mean, it really does help you as an individual relax, take a breath, remember who you are instead of just that role of a caregiver. But then it also means that when you've done that for yourself, you'll be able to take better care of the person you are caring for. In fact, there's studies that show that a short break, a little bit of respite here and there, can actually help reduce elder abuse. Unfortunately, sometimes you have cases where a spouse starts abusing the person they're caring for.
Either mentally or emotionally or a combination.
Exactly. And some of that is just based on when your stress level gets so high, you snap. And so if you never get that high, you're going to provide better care, the person's going to have better health, and you'll have better health.
Now, for decades, there have been various support groups, whether it's Parkinson's or Alzheimer's or caregiver support groups. One of the twists that I think is going to be coming that I want your opinion on is changing the mindset by changing one word. Instead of a caregiver support group, if that was changed to a caregivers education group.
Right.
And that you don't diminish the fact that people are going to be supporting each other, but you're not dwelling on the supporting each other because just being there or watching that meeting online or that education online, it seems that people who are exposed to one good thing that can get that smidgen of short break, and I like that term, once they have the science that says this is real, try it, and then once they try a little bit of it, they will then be hooked and want to know more. And somehow we've got to light a fuse. But there really, to me, is not a fuse I've seen yet, at least in Oregon.
Right. Yeah, not exactly along those lines,
Okay.
but in terms of being able to even participate in a support group or an education group, there needs to be that opportunity for somebody else to take care of that loved one in the meantime.
What exists now, and what do you think is on the horizon?
Well, there's a number of things that are out there now. I mean, respite can take many different forms. For example, it could be a program at a nonprofit, like Alzheimer's Association has the Memories in the Making program, which is an art program so that people with Alzheimer's can go in a group in a structured setting and work on art, and it helps their brains in the process. The socialization is great for them as well. But when that takes 2.5 hours, that gives the caregiver that 2.5 hour break. So it's a win-win situation. But they're not available everywhere. That kind of thing is available in some parts of the state, and it's not every day either. So you also have adult day programs. Now, adult day programs can actually look very different from each other. And what I've heard around the state is that there's not enough. There's a number of them here in Portland, but you get out to Burns, good luck.
Right.
Good luck. And another option is to just have somebody come into the home for a few hours. So that's a role that is being played now by folks with the home care workers, home care agencies, as the home care registry that we have, the Home Care Commission registry, becomes something that the average citizen can utilize, because that's a new policy change as well. To date, it's only been for Medicaid populations, but soon everybody will be able to utilize their registry of home care workers, be able to see who's available for short, like 4 hours at a time, but also who has skills in what area, who lives in what area, who speaks the language and knows my culture that I care about. So that's all going to be available soon. Some of that is already being done through agencies, home care agencies, but it costs money, and it can be kind of expensive to do this. And so we're pursuing what are some ways to make this a little bit easier so the people who really need help can get the help.
When you said we're pursuing, is that AARP, coalitions, or are we really in the brainstorming?
We're in the brainstorming time right now where I'm meeting with as many stakeholders as I can. And doing the literature review, you always have to do that. But meeting with folks who run adult day programs, people who are legislators who would actually ultimately fund any program we ask them to.
Or at least a pilot program to
Yes.
see what works. Okay, keep going.
Yeah. But also some of the health systems. How
Okay.
would maybe, a big health system look at doing respite, under our new healthcare model in Oregon with healthcare transformation? These systems are having capitated payments, so it's a per person payment. So the idea is keep that person healthy with the lowest cost possible. And it might be that instead of having somebody coming in with a heart attack from stress, you've provided them some respite.
And we're talking about the caregiver coming in with a
Yeah.
heart attack from stress of unrelenting, uninterrupted chronic caregiving.
Right.
What about a model that could approach the medical provider that is looking to lower the medical expenses of the caregiver? We'll just focus on the caregiver. And that as that person comes in for a checkup, there is a dedicated space within the so it's not traveling to two places, to a senior center and to the appointment for the caregiver. That becomes at least a modified respite, that if there's some program within Legacy or within Providence, but my appointment is an hour, but I'm dropping that person off
Right.
for 3. So it's really being smart about efficiently working what are the common places that the caregiver is going to go, and having a place that doubles as a
Right.
location.
Yeah, and that's something that, for all I know, they're already piloting that. And that's why I'm meeting with people now to really get all that information gathering now and show that there's momentum. Because we had a system before. It was called Lifespan Respite, and it allowed for some small payments to community-based respite programs, whether it was something that a church group was doing or a small nonprofit was doing. It was enough to keep them going and make it available. Well, we stopped funding that a number of years ago, and other
again-
states have picked it up.
Yeah, again, we as the state of Oregon.
We as the state of Oregon.
But it
yes.
was such a good program, and it was successful for what it was picked up by other states. But at this point, is there a chance it'll be revived, or are you moving beyond it?
Well, we're looking at that as an option because I see this as it needs to be a public-private partnership, that we're not just asking the government, the
Good.
state government, to come in and pay for all sorts of services. We need to have volunteerism. We need to have the private sector step up and provide some things, maybe through an enlightened self-interest. But this is something AARP really cares about caregivers, and this is that one big unmet need that we're seeing that is going to have a huge, huge impact on so many people that will be part of the solution somehow too. It's going to be broad-based, and maybe bringing back the Lifespan Respite Program
As
is
one of the
part
components,
of it,
part of it.
but probably not exclusively. And it is something that I learned before in the work that I've done with you on the Alzheimer's State Plan, that having a lot of stakeholders have ownership of a process and a product means that after that part of the story is done, that they all keep it going.
Right.
And they all make sure that things that you said you wanted to have happen will actually happen. Process is extremely important to being effective long term.
Excellent, excellent. All right, we're coming back for another segment. Very nice.